You cut your hand chopping wood. Blood won't stop. No bandage nearby. No antiseptic. No doctor for miles. The year is 1350. This cut could kill you within a week. Infection spreads. Fever climbs. No antibiotic exists to stop it. This is the world before medicine. And somehow, humanity made it through. So how? Let's start with the numbers. In medieval Europe, 1 in 3 children died before age 5. Childbirth killed 1 in 100 women giving birth. The Black Death arrived in 1347 and killed 25 million people in Europe within 4 years. No vaccine. No germ theory. Nothing to explain why people kept dying. But people weren't helpless. They observed. They experimented. And some of what they found actually worked. Take willow bark. Ancient Sumerian clay tablets from 3000 BC list it as a fever remedy. Egyptian physicians used it too. The active compound is salicin, and your body converts it into salicylic acid, the same family as modern aspirin. They didn't know the chemistry. They just noticed it worked, and kept using it for thousands of years. Take honey. Egyptian medical papyri from 1550 BC describe packing wounds with honey. Modern science confirms honey creates hydrogen peroxide through an enzyme reaction, killing bacteria on contact. Doctors today still use medical-grade honey on certain wounds. Ancient healers didn't know about hydrogen peroxide. They knew wounds packed with honey healed faster. Then came the plague, and with it, one of history's great accidental discoveries. In 1377, the city of Ragusa, now Dubrovnik, ordered incoming ships to anchor offshore for 30 days before anyone could come ashore. They called it Trentino. Later, Quarantino, 40 days, the origin of the word quarantine. Nobody understood bacteria yet. Nobody knew about the plague bacterium Yersinia pestis. But they noticed something simple. Keep sick people away from healthy people, and fewer healthy people got sick. That observation, without a microscope, without germ theory, saved countless lives across Europe for centuries. Midwives carried knowledge too. Long before hospitals existed, women passed down birthing techniques through generations. Positions that eased delivery. Herbs that slowed bleeding. Methods for turning a breech baby by hand. Much of it worked well enough that humanity kept reproducing despite the risks. Monasteries became some of the first hospitals in Europe. Monks grew herb gardens specifically for medicine, cataloged which plants reduced fever, which eased pain. This knowledge got copied by hand, monastery to monastery, for centuries. By the 1700s, doctors were still guessing at causes of disease. But observation kept paying off. In 1796, an English doctor named Edward Jenner noticed something odd. Milkmaids who caught cowpox, a mild cattle disease, almost never caught smallpox, a disease killing 400,000 people across Europe every year. Jenner took pus from a cowpox sore and exposed a young boy to it. The boy developed immunity to smallpox. Jenner had no idea what a virus was. No concept of antibodies. He just tested an observation, and it worked. That single experiment became the foundation of vaccination, a word from the Latin vacca, meaning cow. Even hygiene took centuries to connect to survival. In 1847, a Hungarian doctor named Ignaz Semmelweis worked in a Vienna maternity ward. He noticed women delivered by doctors died of fever far more than women delivered by midwives. He suspected doctors carried something on their hands from the autopsy room to the delivery room. He ordered doctors to wash hands in a chlorine solution before examining patients. Death rates dropped from nearly 18% to about 1%. His own colleagues mocked him. The medical community rejected his idea for decades. Semmelweis died in an asylum, never seeing his discovery accepted. Handwashing, one of the simplest acts you do without thinking, took a man's reputation and sanity to prove. So how did people survive before medicine as we know it? Not through miracle cures. Through millions of small observations passed down over generations. A healer who noticed honey worked. A city that noticed isolation stopped outbreaks. A doctor who noticed clean hands saved lives. None of them understood the biology behind what they were doing. They just paid attention, and they didn't stop trying. Every remedy that worked got remembered. Every method that failed got replaced. Slowly, painfully, without laboratories or microscopes, humanity built a body of knowledge that kept us alive long enough to eventually understand why it worked at all.